Hi, welcome to Baby Mama's Doula, the podcast. My name is Dr. Racheal Onah. I am a naturopathic doctor and as well the founder of Baby Mama's Doula. And today I'm going to be talking about prenatal vitamins and its importance, what to look for and what to avoid when picking a prenatal vitamin. So first of all, we're going to start with B vitamins. B vitamins are so important for energy production, and that's why you definitely want to have good quality B vitamins inside a prenatal vitamin. For example, folate or B9, there's different forms of folate. The type of folate that you want to find is methyl tetrahydrofolate. That is the best type that will help you metabolize your nutrients a lot better. It will help with hormone regulation, it will help with sleep, it will help with fatigue, it will help with nausea. You want to avoid a B vitamin that has folic acid. Folic acid can actually block those receptors and make it very hard for you to actually metabolize your vitamins and minerals well. So a lot of research doesn't actually tell you that folic acid is bad and that folate is good. So this is one of the tidbits that you kind of want to make sure that you are following. Another thing that you do want to have folate and also B12 for is for neurotube development. So you want to make sure that you have those two things inside a prenatal vitamin. The next thing you want in a prenatal vitamin is vitamin C. Vitamin C is an antioxidant that is helpful for oxidative stress. It has also been found to be beneficial for collagen synthesis and also prevents premature rupture of membranes. So it kind of helps preserve the amniotic sac that keeps the baby inside the womb. So you definitely want to have a great vitamin C supplement inside your prenatal vitamin and making sure that you have the recommended dose inside of it as well. So next is vitamin D. Vitamin D is also really beneficial for the growth and development of the baby. It helps grow the lungs, it helps grow bones. It has been linked to asthma in kids that are deficient in vitamin D, so you definitely want to supplement for that. Vitamin D also is associated with low birth weight, it's associated with preterm birth, so you definitely want to make sure that you supplement with a good amount of vitamin D inside a prenatal vitamin. You also want to make sure that you are supplementing with iron. Iron does get depleted during pregnancy, so you definitely want to make sure that you're not anemic during pregnancy, because that can also exacerbate your fatigue, your tiredness during pregnancy. You also don't want to be passing that on to your kid and having complications during labor and delivery. I will want to let you know that iron can be constipating, and sometimes people decide to take iron away from their prenatal vitamins because it's one of the deterrents of women being compliant taking their prenatal vitamins is the iron. So sometimes women decide to take a prenatal vitamin without an iron and then taking the iron separately. And usually I would say using magnesium just to kind of help with that constipating factor of iron, but it's one of those things that you should not be foregoing during pregnancy. Speaking of magnesium, you also want to be supplementing with magnesium during pregnancy and even postpartum. And as well as magnesium, you want to make sure that you are taking calcium. So taking them both together is also important. So it's making sure that that's in your prenatal vitamin. Babies just leach all the magnesium and calcium out of your body, and it has been linked to osteopenia in women that are deficient. So making sure that you have that inside your prenatal vitamin is important. Speaking of magnesium, you also want to be supplementing with magnesium during pregnancy and even postpartum. And as well as magnesium, you want to make sure that you are taking calcium. So taking them both together is also important. So it's making sure that that's in your prenatal vitamin. Next up is zinc and copper. That's something you would also most likely find in a prenatal vitamin. It is really important for wound healing, it is great for the immune system, helps build the immune system for mother and baby. It has been linked to low birth weight and malnourishment. Zinc especially is great for protein synthesis, building RNA, DNA. So a lot of the neurological side, you definitely want to have zinc. Zinc is important for almost 200 pathways in the body. It can help prevent congenital malformations, especially for the central nervous system and the neural tube. So it also has a role in neural tube development. So you want to make sure that you're getting zinc. So yeah. Okay, so now I'm going to be talking about other things that may not be in a prenatal vitamin, but something that you should be supplementing during pregnancy. So the first thing is essential fatty acids or fish oils. I do like it to be higher in DHA because it does help with neurotube development and brain development for babies. The reason why I also like essential fatty acids is that it helps prevent postpartum depression. So taking it during pregnancy and postpartum can also prevent postpartum depression. So that's another thing that I do like. CoQ10, one of my favorite things, it helps reduce the risk of preeclampsia. It also helps prevent the risk of miscarriages. So that's another one that you should be supplementing outside of a prenatal. Iodine, selenium, arsenic, depending on the person, can help with thyroid. Sometimes people are hypo or hyperthyroid and should be supplementing. You can't take thyroid medications during pregnancy, so it's one of those things to look at on an individual basis. Probiotics, good for urinary health. And then adrenal support, so making sure that you are picking things, speaking to your naturopath, that are helpful for mitigating stress and anxiety. Okay, so now I'm going to be talking about things that you should be cautious of, or things that you should make sure that you avoid during pregnancy and sometimes postpartum, especially if you are breastfeeding. So when you are picking out a prenatal vitamin, you want to make sure that it doesn't have any toxic chemicals, toxic metals such as like lead, cadmium, arsenic. They sometimes can be found in prenatals and people really aren't aware that they are there. So it's one of the things that you want to make sure are not inside a prenatal. It does go to the fetus, so make sure that you are picking cleaner prenatals. Sometimes cost is an issue and your family doctor will recommend a pharmaceutical grade, and it's covered by your insurance or OHIP, and sometimes you are led to that way, but there are prenatals that are a lot cleaner that will be safer for you and your baby. You also want to avoid cheap supplements that have additives, synthetic fillers, bulkers that can affect the health of mama and baby. And then now I'm going to go into things that you should definitely avoid. So one of the things to avoid or to reduce the dose is vitamin E. Although vitamin E is an antioxidant, it does have a role with thinning the blood. So I did talk about vitamin K earlier, and they both compete with each other. So whereas vitamin K has blood clotting factors, vitamin E thins the blood. So you want to definitely make sure, especially in the third trimester, that you're reducing your vitamin E intake. The next thing is vitamin A. High doses of vitamin A can lead to birth malformations inside kids. It can be teratogenic, so it can cause abortions. So you definitely want to make sure you're reducing the amount of vitamin A, especially avoiding any supplement. Vitamin A is found in food, but you want to make sure that you're not supplementing above what your dietary intake is. Last but not least, one of the things that I definitely recommend you avoiding is botanical herbs. I try my best not to recommend any botanicals during pregnancy, and I err on caution during lactation. A lot of botanical herbs are contraindicated, can cause fetal malformations, can cause abortions. Top ones to kind of avoid is black cohosh, golden seal, donquay, yohimbe. They're the ones that are highly linked to birth malformations. So I typically would recommend you avoiding those and just trying to avoid most herbs. Some herbs are really beneficial, like ginger, great for nausea, but speak to your naturopath, speak to your healthcare professional before deciding to add in any botanical herbs into your prenatals or your supplemental regimen during pregnancy and lactation. So thank you for listening to Baby Mama's Doula today. If you have any questions regarding prenatal vitamins, if you need holistic support, please contact Baby Mama's Doula. Our website is www.babymamasdoula.com. Our email is also babymamasdoula@gmail.com. You can also find us on Instagram at Baby Mama's Doula. So there's many ways that you can reach out to us. I hope that you enjoyed listening to us today, and we have more podcasts available exclusively on babymamasdoula.com.